Welcome everybody, it is Business Monday. We are back with the money man, Gary Sasse. I'm Josh Fenton, CEO and co-founder. Gary Sasse is the head of the Hassenfeld Institute at Bryant University and often known as the money man. Money man, this is, for average people like me, we've lost thousands of dollars. For people like you, you've lost millions of dollars today in the stock market. Market's down just under 7%. Potentially could end the day as the biggest one-day loss since '08. This is obviously mostly fueled by the coronavirus, triggering a series of things related to trade, oil consumption. Walk us through where we are today in America's economic condition.
We're in a very unstable place. As you pointed out, businesses all through the world, in Rhode Island, in the United States, and Asia, and Europe, Africa, are dealing with lost revenue, and they're dealing with a disrupted supply chain. One funny story is the National Hockey League is part of that problem because they can't get enough hockey sticks. They made,
they're made
in China. So they're losing revenue, their supply chains are disrupted. China is having the slowest rate of growth it's had in over a decade. Oil prices are falling. It's the first global drop in demand in probably 15 or 20 years. Prices are down by about a third, but that doesn't mean very much with these other economic conditions. As you pointed out rightly, the stock market has collapsed, but the stock markets are collapsing all over the world. Today in London, Paris, Frankfurt, the stock market was down 7-8%. You mentioned 6.5% in the United States. In Italy, where there's been the largest concentration, it's down 11%. So you're seeing unprecedented one-day declines in stocks. Various industries are losing businesses. The airline industry will probably lose this quarter about $113 billion. Just for an example, Japan Airlines alone is going to lose over $1.5 billion. Commerce is disrupted. Even a company like Apple and their Chinese affiliate Foxconn is having significant production delays. Companies like Nissan and Hyundai are closing plants because they can't get parts. It's uncertain what's going to happen to Big Pharma because a lot of the ingredients are made overseas and a part of the supply line. From a social and from just a community presence, the impacts are also very significant. There's a lot of uncertainty about lockdowns, how it affects.
People don't know what to do, right? So
Yes.
You've gotten a big event. I saw Bryant University Friday. Katie Makeley announced that the Women's Summit, the 2020 Women's Summit that's supposed to be the end of this week, is postponed till at least June.
And there were discussions, what do you do? Students are on spring break in March.
Right.
The students will come back in a week or 10 days. Where they went, who they associated with, we don't know.
Right.
And so universities have to make a call. Big universities have it easy to make that call because they can gear up to virtual learning very quickly. Middle-sized and small universities, not as quickly, and it's expensive. So there are tremendous social costs, which will translate and seep into the economic costs from these lockdowns. Just look what's happening in northern Italy today. The entire economy of Italy, because they had to close Milan and northern provinces in that country, are shut down. So you and I were not around in 1928 and 32 with the Great Recession, and I'm not suggesting this will be a Great Recession, and no one knows how long it's going to last. And we're more resilient, we have better protections. But some of the things that we're sensing were things that we were sensing then. The only difference being employment's still good. Employment's still stable. So
February numbers were actually quite impressive considering that the coronavirus hit really at the beginning of the month in some level of mass. It seemed like jobs were resilient. The other thing I think has been, so many people, decision makers, seem uncertain what to do.
And that comes from the top, because I will tell you this, no one can blame this administration or any administration on the coronavirus. That's an act of God or an act of nature. But how you react to it, how you make decisions, and when you make decisions recognizing that you're not always going to make the right decisions, but you need leadership. And what we have learned going back from pandemic to epidemics, going back hundreds of years, is that a public health crisis requires public trust.
Yeah.
And there is no public trust, and I say no, there's very limited public trust that people have in this White House. And I'll give you some examples of things that may have been the right decision, may have been the wrong decision, but would give people some confidence and understanding that somebody knows what they're doing. A testing certainty.
Right.
Free up, segregate testing places. In a simple place like Rhode Island, you could go to labs and just buy half the labs and have them as isolated, segregated testing facilities. Make sure that people understand that when they take the tests, if they don't have insurance, it'll be paid for. A policy on social distances. The thing that we were talking about before. Do you cancel school? Do you cancel an event? What guidance, what direction should you get on that is to avoid some of this uncertainty. It's better to have a fiscal stimulus now. As bad as our deficit is, it's going to cost us a lot of money, and we better figure out how we can spend the money up front.
So do you do a stimulus now, or do you wait at least to see what sectors are going to need propping up?
No,
I mean, certainly the cruise line industry. If you want to keep it around globally, you're going to have to do something for them immediately.
Well, you need to do stimulus to deal with things like our governor is talking about, for example, on paid sick leave,
right?
On goosing up unemployment insurance, and those type of things are going to have to be stimulated. There are other kinds of stimulus activities that can be considered, but it's a two-step version. If you wait till the end of the process to do the stimulus, people are going to get hurt. It's going to be much more expensive. A credible, consistent, policy. So these are the kinds of things that didn't take rocket science to figure out, but these are the areas that we needed to make decisions upon, that we're not making decisions on, that are contributing to the uncertainty, and it is a result, and this is a political statement, but I really believe this strongly, of a dysfunctional White House. You have the president going to CDC in his campaign hat talking about his grandfather that taught at MIT. You have the president saying if anybody wants a test, they can get a test. The night before, his spokesperson on this, the Vice President of the United States, basically said, we haven't got all the tests we need. We're working on it, and by the middle of next week, we hope we're up to speed. So at the national level, you don't know who to believe. You're getting mixed messages. They're not clear indications of policy. Now, that's not going to make things better. The disease is still there. There's going to be an economic downfall. But certainty, predictability, leadership, trustworthiness are psychological aspects that have to be addressed, and this administration has really dropped the ball on that.
Where do we go? What do we see going forward? Let's have an expectation that probably the rest of the week is probably not going to be the biggest bull market in the history of the U.S. economy. We're probably going to see maybe a little rebound here, a little rebound there, but it will probably lose on the week. Would probably be a logical expectation. We're going to see, obviously, as tests get out there, we're going to see a lot more cases. We're going to go from hundreds of cases to thousands of cases in the United States.
And you can't give people absolute reassurance because we're dealing with an unknown. But a lot of our governors are doing a much better job than the president. Governors in Oregon, governors in New York, I think Washington, Maryland, both Democrat and Republican.
Yep, and a number of them have issued state of emergencies. Governor Raimondo has not. We've asked her office a couple times about why not. They say that has chosen not to yet. Does activate a number of powers that can be beneficial.
And federal support too.
Yeah.
But the governors take some steps today in that direction. She announced emergency regulations on workers' comp access, on paid sick leave, on getting to temporary TDI, temporary disability, on speeding up unemployment insurance. So she's recognizing that. But I think the question of, and she's made some good decisions on testing by advising people to go to mobile testing units.
Yeah.
So they've been working at it. I think the next step is to, frankly, declare a state of emergency and mandate segregation of testing facilities, She started the fiscal stimulus. I would love, being out at Bryant, I'd love some direction on social distancing.
Yeah.
And not that the state would necessarily make a better decision than the university or a private business, but what sense does it make if institution one in the state, a business, has one policy on distancing, place next door has another policy? You need some gubernatorial leadership. So the jury's still out. The governor's been working hard. I think there's more that can be done. I think we have enough evidence now that this situation is going to be hard to constrain.
Well, aren't there some indicators? Johns Hopkins canceled the fan attendance at the Division III playoff basketball game. Johns Hopkins has more smart scientists than maybe any place else in the world relating to healthcare. And they did allow their home lacrosse game to go forward. So they must have made an analysis based on input from the smartest people in the world who said, listen, don't put them in a confined space 1 inch apart from each other, but it's okay if they're outside and they can spread out a little bit.
Well, see, a lot of it's common sense, and what the state health department's done has done a good job on common sense stuff. They got a preparedness task force together. They've been advising people on how to do personal hygiene, how to access medical care if they need it, et cetera. So a lot of the common sense stuff is being done, but it needs to be taken one step further. We've now passed a certain point that we know it's not going to disappear tomorrow. The president waving it away because the weather got warm is a myth. And so, in terms of testing, segregation, fiscal discipline, those kinds of things, social distancing, we need state direction and state policy. And this state government has access to national and international resources to make those decisions. And so I think we've made steady progress. I think the states have made steady progress. But now the situation has reached a point where the state involvement has to become much more invasive.
Colleges are reporting now, I think some are back. Brown's testing 3 students, I believe, announced today. Rhode Island Hospital has announced no more visitors to visit adults. You can still visit, parents can visit children at Hasbro. Nursing homes are really cutting back on access to those facilities. Should we have been a little bit more aggressive on those things?
Absolutely, but that's like second guessing. It's like asking someone that if it's 3rd and 3 and you decide to throw on 3rd down and the pass is incomplete. You're second guessing. I said, why don't you run on?
Right.
That's
well,
not fair to
it's
say.
a little bit different. I mean, it's a tenor and a tone to how you approach emergency situations. Do you wait back and see, or are you very, very proactive and rather be criticized for being overly aggressive, but by restricting people and restricting events?
Well, I think we could have been more proactive, but I want to put it in.
Should we shut down events at the Dunkin' Donuts Center?
I don't have the expertise to tell you that. I will tell you this, and the point I want to make is that we can say state government, whether it's Massachusetts, Connecticut, Rhode Island, wasn't aggressive enough to begin with, but they're not separate entities. They're part of a bigger nation, and they're getting absolutely zero direction. You're getting trite remarks from the White House,
right?
And so I go back there. I think it really is the head of the fish that's important. And if they were getting clear directions from the White House on all the points I've made about testing and segregated testing and fiscal stimulus, social distance policy, how to access physicians, and there was a series of best practices that came from the feds. And there was a saying that you needed emergency regulations so you can get around state bureaucracy and state rules on purchasing, on hiring people. We may need to hire a lot more people. I worked as director of administration. You can't do it the next day. So you need emergency powers to get around some of that. You need emergency powers if there's a certain commodity you need to buy without going through the
purchasing process.
So yeah, those things needed to be in place. We could have moved quicker. But we're here now. We know what to do. What I've outlined is probably what every governor in the country is looking at. And I think it's time to take that next step because it's not going to disappear.
We're almost the halfway part of March. Let's call it the first quarter. This is not going to be a 3% GDP, and in Rhode Island, it certainly isn't going to be a 3% GDP. Let's talk about what steps need to be taken in managing the state's budget to be able to adapt and also deliver a balanced budget at the end of the year.
Well, that's going to be, difficult because so much of the budget, we're 3/4 through the year, so let's assume that 70% of the budget has been spent. Let's also look at the budget and understand that 2/3 of the budget that the state appropriates is not spent by the state. It's spent by individuals in the form of medical assistance, Medicaid, social services, or another $1 billion is spent by the cities and towns to support their schools. That money's gone. Mm-hmm. So you can say that we can take money back on entitlement programs. Well, that's the last thing you want to do in this kind of atmosphere. The last thing you want to do is take money back, from schools, because then they couldn't complete the year.
Right.
So you're dealing, with roughly 20% of your budget. A lot of it is people. It's very hard to get rid of people. So you have to begin to look at ways to clamp down on spending. But I'm speaking out of both sides of my mouth.
Right. You get a lot of, stimulus type of initiatives coupled with a need to adapt to potentially lesser revenues.
And there's a real tough management challenge. But then what you generally do is you go through the budget and say which larger items, not big items, which larger items haven't we spent, and you put a freeze on those items. The moral of the story, though, and no one recognizes this when it happens because they get bored and they understand, they're not interested, is if we weren't running structural deficits, then when an emergency like this happens, you do go into deficit. It's no fun, but you have a little bit of wiggle room. And because
then those cuts that you might make for next fiscal year can be applied to the cost overruns that you've incurred with the stimulus.
But our budget's not balanced. Our budget wasn't balanced the day it was passed. We in terms of having a budget that's balanced operationally, where current revenues equal current spending, our current spending exceeded our current revenues. There were prior year surpluses, other things that enabled us to do that. In addition, there was $100 and $200 million out-year deficit forecast. Now it's considerably less than that. But you're still working to bring down the deficit, and now there's more pressure on the budget, and the deficit makes it much, much harder. I don't want to mention the T word, but at some point, people are going to have to look at revenues. Very hard, and this is another catch-22 issue. It's very hard to talk about revenue enhancements or the dirty word.
Taxes, let's call them taxes.
Well, yeah, you call them taxes. When the economy's not good, it's the worst possible time to talk about them.
Taking more money out of people's pocketbooks.
Yeah. So I
less spending.
I would freeze everything I could freeze. I would look at what major items that were unencumbered at this point, or those that were encumbered, see if I could change that, and just put an absolute hold on those to try to get to a balanced situation, recognizing that I'm going to have to do a lot of adjusting in the budget. And it's further complicated by the political fact that the governor did not fund the car tax phase out at the level the speaker wants, and that seems to be a line the speaker won't cross. And you could look at other items in the budget, which are very unpopular. The speaker said, I think he said this, somebody did, that some of the governor's tax proposals were dead on arrival. Are they still dead on arrival?
I don't know. Let's go up to the State House. Obviously, the Speaker of the House, Nick Mattiello, is in a very complex situation. There is a grand jury sitting now. It's been well reported. And a number of players from both his office, his personal friends, and representatives of the convention center before a state grand jury. Rhode Island State House dynamics is fueled off the leadership of the Speaker of the House. How difficult will it be for him to make decisions quickly, effectively, and negotiate with both the governor and the Senate president?
Well, sometimes necessity becomes the mother of intervention. And I think when you look at what's happening around the country with this crisis, the other stuff, as serious as it is or isn't, is really pretty parochial. There's a much bigger issue than the parochial inside fighting in the State House right now. I think, I have reason to believe that those kinds of discussions, those personal relationships, are very tough. But when you're confronting a situation where people in your state are contacting this virus, that you have to do everything you possibly can to limit that. I think there's enough good faith to do that. Doesn't mean you love each other. Right. It's the old story. We can hold hands, but we don't got to go to bed. That's the story.
There's a little difference, though. This isn't just political infighting. This is the Attorney General conducting an investigation.
We'll see where that goes. I spend a lot of time, speculating on that. I'm not sure how valuable that is. Where it ends up, it ends up. Worst comes to worst. There will be a speaker. There will be a governor. There will be a Senate president. They will still have the same responsibilities. The state will be confronting a crisis, and they will behave hopefully responsibly. Not that you and I would agree with every move they make, and not that every move would be fiscally sound or not, but there's a calendar, they're individuals, and there's responsibility, and I assume they'd meet that.
Cities and towns, we don't really ever talk about cities and towns in this situation. To some degree, cities and towns, because of their schools, are at the front line of these things. We all know what the depth of school departments are in Rhode Island, the depths of expertise on complex health issues, the ability to have hot water and soap in bathrooms. This is really taxing Rhode Island's oftentimes very thin infrastructure.
Yeah, but I think the superintendents in the school principals, school administrators understand that. But the point I was making earlier about leadership in this case has to come from the top. The state has to.
I don't disagree, but there's got to be somebody who actually knows what to do when you get to the Central Falls School Department.
No, that's true. And the things.
We've proven we're not great at education. So, but is there the physical bodies to make sure that kids are washing their hands 6 times a day?
I don't know. I think when you talk about a fiscal stimulus and talk about the other things that we've talked about, policies have to be put in place and people have to be held accountable for implementing those policies. There's a teacher for every 25 kids. He or she can add to that responsibility. Sure.
What's your expectation? What do we see next?
Boy, I don't know. I'd rather predict the Super Bowl, but based on just trend lines, it looks like containment. We're not to containment yet. There's a growing problem, and the question will be how severe and how quickly, can we put in place containment issues? But every time you pick up a newspaper, every time you hear something on TV or read the story, you find out about 3 more cases here, or unfortunately the deaths, there. So it doesn't look like we're at the point of containment yet.
No, not close.
And we have to work, that's what we have to work.
And the lack of testing, you're seeing in Italy play out in front of our eyes, massive explosion in the number of cases and sadly the number of deaths.
Yeah, and so the policy is really, all these things that we've discussed today, really are directed towards a policy of containment, that you don't get there in one day, but you got to test, you got to have a place to test, you have to have test kits, you have to spend money on things that will support that, will support people who are being economically displaced. You have to give guidance to public schools and private schools and business about what are acceptable conduct during this period of time. And I think you have to declare a state of emergency at a certain point, so you have the flexibility.
All the tools you can possibly
Absolutely.
have.
If you don't use them, that's fine.
Yeah.
But there's no, I can't, what's the reason for what we know now?
I think we're up to 9. Earlier this morning it was 9 or 10 states
Is that many?
had declared state of emergency.
And if we had a real leadership in Washington, a state of emergency would be declared.
Yeah, nationally potentially.
And over half the states now have cases of the
corona. It's almost 40, I think.
Is that right? Coronavirus? It's increasing. What else do you have? What else does the national government need to know not to
Right.
declare a state of emergency. And that would help all those states. I don't know why the governor didn't declare it. I'm sure she has her reasons for not. But if the national government declared it, would be on an even footing that way.
Last subject, how does this affect presidential politics?
Being a never Trumper, I hate to use a crisis to talk about politics, but I think the dysfunctionalness, if that's a word, the hyperbolic statements that come from the White House could be defended by supporters of the president when it dealt with foreign policy or dealt with a domestic issue. But when people are so adversely affected by this, they don't give a damn. And so I think I think
People are looking for competency over ideology.
And that could be one reason that Vice President Biden seems to have surged ahead in the Democrat primary.
Up nearly, I think, 15 or 16 points in the CNN poll released this morning over Bernie Sanders.
And every Democrat, this is when Bernie says these are institutional Democrats. No, they're not. Some are, of course. They're minorities. They're African Americans. There's a pretty broad swath of Democrats, regular Democrats, who are supporting, Biden, and you have to ask why. Because I think people now are recognizing that government is important, that if government doesn't act, properly, it can affect your security. Mm-hmm. It's affected our national security, but that's a little less direct, and that they want calm, competent, government. No one's reading page 601 of the Medicare for All program right now. Their major concern is, how do I get tested? Yeah. How do I get tested in a
keep my family safe, keep my grandparents safe,
that's what government,
etc.
And that's what government's about. Government is really to protect the health and welfare of its citizens. And safety, and that's why it's there. And right now, it's not done a very good job at that.
Gary Sasse, thank you. The money man, Gary Sasse, head of the Hassenfeld Institute at Bryant University. I want to thank everybody for tuning in. Thank Michael Fine, former director of the Department of Health, who's joining us every day at 12 noon. Today was his first episode and gave, I think, some great insights into what needs to be done. And we'll be back on the air at about 4:30 over at a press conference with Governor Raimondo, live from the Department of Administration. Stay tuned to that. Thanks, everybody, for tuning in.